excited to have you here today. And I hope everybody's doing good on this Memorial Day weekend. We appreciate Beth coming on and giving us a legislative update. We wish it was the final one of the year, but unfortunately, no, they're coming back. Darn it. And it's like never ending now. Welcome everybody. We're happy to see you. I wanted to introduce to the group Deborah Dunbar, who is our new community engagement coordinator for the PD and Low Country part of the state. And so welcome, Deborah. And many of you know her as our board member, so our former board member. So she is now working with us, and we're happy to know about that. I will turn it over to Tara now.
Yeah, I don't have much else to say, but thanks for coming. Those of you who may have asked or been looking for our summit recordings, we just received those yesterday. So next week I'll start going through those and uploading them to our website. So I guess June is pretty close. So in our June newsletter, I'll put a link to those summit recordings if you've been looking for those. Sorry for the delay. It just took a while to get to us. But we're excited to have you this Friday morning, getting ready for a long weekend. We're again thankful for Beth for being here, for giving us some updates. So I'll pass it over to her and let her carry on with the presentation.
All right. Well, thank you. Let's see. Okay, I don't know if you guys can see or not. I learned a new term last weekend. I spent the weekend with one of my goddaughters who just finished 9th grade, and she took me to Sephora and Ulta, which is all the craze now, right, for these young girls. And so I learned a new phrase, and it was called 11s. Do you guys know, if you're familiar with that phrase? No? Okay, so I'm gonna be very vulnerable here. I'm gonna zoom in. Do you see these little things right here between your yes? Okay, so those are called 11s, and I have received those from Fighting Big Tobacco. I'm just going to say that. That's my disclaimer. I have received these from Fighting Big Tobacco, and I haven't even been doing it as long as many of you on the call. And like Barbara said, we are still going. The General Assembly is still going. So typically, the General Assembly adjourns the second Thursday in May, and that's sine die. However, they did not pass the state budget, and it was quite an interesting last week at the General Assembly. That last week, or really the second week in May, their last official week at the State House. There were lots of bargaining and lots of chips going back and forth, and senators moving over into the House to argue different points. And so we saw a lot of different legislation really just be turned upside down. The biggest takeaway, a couple of big takeaways, is that the state did not pass a budget, which again is not all that uncommon. We've seen in the past few years the budget process, that the House starts the budget process, they generate the first version, then it goes to the Senate generates their version, then it goes back to the House for version 2. And what we are working on now is a compromise that 6 members, 3 of the House and 3 of the Senate, will gather and will meet starting next Tuesday, and they will come together and pull together a compromise for the overall state budget. So why is this important to us and our issues with tobacco? A few things. One is that we made the ask for additional tobacco prevention and control funding. And I was excited to think and to hear that Senators Alexander and Senators McElveen and Senator Shealy really were all very willing to put in an ask for tobacco prevention and control and prevention funding that would pull from the Joel settlement dollars that South Carolina has now been receiving for 2 years. And that funding comes in around every December. It's been a couple $1 million, and it's kind of on this sliding scale, and South Carolina will actually receive that money for, I believe it's 2027. And so we asked for a portion of that money to go to tobacco prevention and control. And in the Senate version of the budget, the Senate put in $1 million, which is great. The House version put in $1, which is a holding place. And so now they will go to conference, and they'll kind of hash out and decide where they will land. The other interesting point that I want to kind of bring up is that just this week, the Board of Economic Advisors, who is a group of, they're a group of about 5 or 6 men, accountants and financial advisors for the state, they actually came forth and said the state has another $614 million that they can spend. So that is new money that this group of 6 will be allocating to different projects, different programs through the state. So my ask now to this group of 6 is we want more. We want more money. We want money for tobacco prevention and control. And we'll see how they take that ask, if they give us $1 million, if they give us somewhere in between, or if they give more. We're not really sure how that's going to look. But I am excited that we at least are in the Senate version of the budget, and we'll see how that funding kind of all shakes out. This funding would not in any way compare or jeopardize the additional funding that is going to the tobacco division, the $5 million that goes annually to the tobacco division from the revenue generated from the state cigarette tax. And it wouldn't also, impact the $5 million that is generated again from the revenue of the cigarette tax that goes to MUSC to work on tobacco research. So this is additional funds. So I'll kind of pause there, and I have a few other legislative updates, but I'll pause there and see if anybody has any questions about that part of the process.
So Beth, would it help if we sent emails or called the conference committee members?
Absolutely. Yes.
And so who are they, if you don't mind?
No, 3 senators. So we have Senator Harvey Peeler, who's from Gaffney. Senator Sean Bennett, who is from Somerville, Charleston Market. And then Senator Nikki Setzler from Columbia, Lexington, West Columbia area. And then in the House, we have Bruce Bannister from Greenville. Philip Lowe, who is from Florence. Deborah, he's close to your area, somewhat, the closest to your area. And then we also have Stevenarkis. And Stevenarkis is down in that Charleston, I want to say the Charleston market. Leon Stevenarkis. And I'm looking him up. He is one that I have not worked with much. However, I am hearing that he is open. His Leon Stevenarkis in the Charleston market. I'm hearing that he is very open. And I think he would be very favorable to the issue.
Okay.
The best way to reach them.
Should we send them individually? Should we phone call? Should we send, or could we do draft an email and send it to all 6 of them?
Yes. So the best way I would say to contact them right now is possibly through an email. Our team put together our team put together an action alert. And I can send that action alert to you all. All right, let's see. I'm going to find it.
If you send it to us, Beth, we can certainly send it back out. I haven't seen it, but
okay. It probably has not even come out yet. It probably is coming out I think it's either going out this morning, or it may be going out on Tuesday.
Okay.
Yeah, we have a couple of other action alerts and things tied into the budget, so we're trying to pace what we're doing here. But I will get that action alert out to you all, and please feel free to use that action alert. It goes directly to the members. The members are not, so the other thing is that these guys are in district right now. They're not at the State House. They're not in their offices at the State House. So, you can call and leave a message there, but really I would say send an email, send an action alert. If you know them, or know someone who knows them personally, someone who lives in that community, have them just say, hey, look, by the way, we want you to, and here's the phrase I'm using, we want you to hold the line on the Senate budget when it comes to tobacco prevention and control. to hold the line on the Senate budget when it comes to tobacco prevention and control, because the Senate has us in there as $1 million. We just need a House to agree to that.
Okay.
Yeah. All right, so a couple of other things that happened this year as well at the General Assembly was there was a cleanup bill that we talked about really early on, and this was a bill that was introduced. It was pre-filed. It was House Bill 4817, and the General Assembly folks were actually calling this a cleanup bill from the preemption bill that passed last year. And this specifically related to vending machines, and also some language around age and proof of age. And so this bill was one that we were monitoring. It didn't help or hurt. It just kind of monitored the issue. And what the preemption bill did unintentionally, which was not a bad thing, but unintentionally, the preemption bill had a clause in there about vending machine sales. Interestingly enough, the big tobacco lobbyists didn't realize that we still had vending machine sales in South Carolina, and we do. Vending machine sales are in adult-only establishments. They can have vending machine sales of tobacco. And so it kind of cleaned that up. Again, didn't hurt or harm us, was kind of in the middle. So we monitored that, but that bill did pass. It was introduced in the House and it passed the Senate.
What exactly does it say? Because I noticed in the preemption bill that flat out said no vending machine sales.
Right. So this just cleans it up and says reverses that line.
Darn.
It amends that bill so that it allows vending machines to be in adult establishments like they previously were. That's, yeah.
So Tara, where was yours? Was in a bar, was it not?
Yeah, but during the day, it's just a restaurant. Anyone can go there during the day. I think at nighttime, it's only 21 and up.
Yeah.
But there's a place in downtown that has a vending machine with vapes.
We should look into that, Tara, and see how they are filed as a business and see if they are listed or if they're registered, like in their business license, how they classify themselves.
Okay.
That would be interesting to find out. I don't know. So when we think about tobacco prevention and control, I know I sound like a broken record because when we look at policy work, we look at the big three always. And that's really what guides ACS CAN's national policy, as well as the national partners, Heart, Lung, TFK, ANR. So we look at, what has the greatest impact? One we know is the price on the product. So tax on the product, increasing the price of the product. The second thing is tobacco prevention and control funding. Can we increase the funding? CDC recommends South Carolina spend about $55 million on tobacco prevention and control. We're not close to anywhere close to that. But are we increasing the amount that we spend on prevention and control? And the third thing is smoke-free communities. And so when we have these bills that come along, smoke-free communities, eventually leading to a statewide smoke-free bill. So when we have these bills come along, like this cleanup bill from the preemption and the vending machines, we monitor it to make sure there's no other bad preemption language that's being slipped in, but it's not something that we spend a whole lot of our energy on. The other bill that we saw at the State House this year that was a result of the preemption bill, again last year, and a result of a bill that the American Heart Association introduced last year was the tobacco registry bill. And the bill that was introduced this year, it was Senate Bill 994, and it was specifically addressing e-cigarettes. And so they called it the vape registry bill. And the tobacco industry pushed out this bill, introduced this bill under the pretense of taking products from China off the market. And that's really how they sold this bill to legislators. So they were very concerned about not only synthetic products, synthetic vapes, electronic cigarettes, but they were also concerned about their market share. R.J. Reynolds and Philip Morris were concerned about other retailers coming in on their market share and selling illegal, they're not really illegal vapes. So they introduced this bill that would require a vape registry, a tobacco, not a tobacco, all tobacco registry. It would just register electronic cigarettes. Specifically, they were calling them, again, vape products. So this is a bill that we softly testified against. And we had to be very careful because this bill was sponsored by Senate President Thomas Alexander. And Senator Alexander was also the champion of our financial ask for prevention and control. So it gets a little iffy there. But Andrew Wylam and I from the Heart Association testified against this bill in subcommittee. And we were sort of laughed at because they couldn't quite decide if we were supporting or opposing the bill. And that's okay. That's kind of where we wanted to be, because we wanted to state the facts and to get our point across, but we also knew we had to walk a very fine line with the Senate president. You're going to shoot yourself in the foot if you oppose the Senate president's bill. So we had to be very careful to do that, because he will then shut you down for anything else you make a request of. But I think that's what's interesting with this particular bill is that how the tobacco industry sold this bill. And we saw some of our champions for preemption even who were on this bill, and everyone thought that they were doing such a great thing. They had the mayor of Columbia. They had folks from Oconee and Walhalla area, which is where the Senate president lives. They had all these people come in, and they brought tons of different vaping products. They brought the little gummy bear shaped looking ones. They brought all the different colors, all the things that we know and see. It was so interesting to me that they brought them in to the subcommittee and said, we've got to get these things off the market. Now, granted, this is the exact same argument that we were using last year with some of the exact same products to fight preemption. But because the tobacco industry was pushing it and they put this spin on it, we got to get these products off the market because it was, harming their market share. Legislators bid onto it in a big way, and so it flew through the Senate with little to no debate. We did hear some interesting infighting on this particular bill between Big Tobacco and Big Vape. And so the Vaping Retailers Association, VTA, Vaping Technology Associates, VTA, they were kind of fighting with RJ Reynolds and Philip Morris because they were concerned about their small mom and pop shops that are selling these vapes. So that was really interesting to watch, and kind of this combination. So as far as what we did with tobacco or National Tobacco Control Partners is we let them fight it out, which was kind of interesting to watch and see and to listen to. We did hear some testimony from new Senator Dion Tedder, who's also from that Charleston market. He took the place of Senator Marlon Kempson. And so Senator Tedder was speaking in support of the VTA, the Vaping Technology Associates, and was trying to make it a little bit easier for them to sell these products. Thankfully, this bill stalled in the House. So it did not pass, which is a good thing. And I'm going to count that as a win. It did not pass. I think the timing of this bill moving through the House paused it. It slowed it down. We were able to submit testimony in the House. We didn't share live testimony. We submitted testimony. We also shared the white paper that the Public Health Law Center did on the vape registries and if they work or not in states. And then we shared as well the information from the FDA and their new registry that they created as well just a month or so ago. So we tried to push it out and say, this is redundant. This is the AG's office would be the agency regulating and managing this. We tried to say it was redundant. It was a waste of time. It was a waste of money. The AG office should be working on other things, fighting criminals and not regulating tobacco. So thankfully it stalled in the House. And if it's to be reintroduced, it will have to go through the whole process because we are closing down the second year of a 2-year session. So all bills that didn't pass will have to be reintroduced. And we might see it reintroduced in December under pre-files, but Maybe, maybe not. I have a feeling the industry may take a pause on that. We've seen that registry that we had 18 registry bills running across the country at one time. And now we have kind of our second roll of states like North Carolina going into session and in session Louisiana. And they're starting to see some of that now as well. So congratulations. That's a win for us. Okay. We're going to count it as a win because it paused them and made them just kind of stop for a second. I don't know how much time I have. I wanted to shift a little bit to some, how are you doing? Questions or thoughts?
You're fine. You have as much time as you need.
All right.
Yeah.
Okay. So I wanted to shift a little bit and just say that, you know, with our state house work for next year, what we hope to do, the goal will be to, you know, potentially ask for tobacco prevention and control funding, depending on what we receive this year. That JUL money that's coming into the state from the lawsuit should go to tobacco prevention and control. And so that's what we're going to be fighting. We want all the money. If we get $1 million this year, that's great, but we want every single bit of it minus administrative cost. So that's going to be the ask for 2025. And then we're going to continue working on local smoke-free when it makes sense, where it makes sense, hopefully building up to a statewide smoke-free law. The best practice from our perspective, so for national partners' perspective, is to have 50% of the population covered under smoke-free ordinances before you start working on a statewide ordinance. So I think I heard last week that the town of Vance was able to pass a smoke-free ordinance. So great job, team, for working on that. Maybe that was Hold Out the Lifeline and those folks that were kind of leading that effort. So that's excellent. That's great. And so Vance is a small town, is a small little, you know, area, but it continues to add to the overall population. And so we're excited. We're thrilled about that. We also, from our perspective, from the perspective of ACS CAN, we are looking at, again, focusing on the top 5 cities, the top 5 counties by population that do not have smoke-free ordinances. And that has been and will continue to be the areas in the state that we are focused on. Phil and Wendy are leading a campaign in Greer to work on smoke-free Greer. I think it's a slow-moving campaign, but it's still happening. It's still moving, and I think that's encouraging. That's positive. We are looking at other areas around the state where it makes sense. There is no more low-hanging fruit in our state. Everywhere now is challenging, and so we're trying to determine where does it make sense? Where do we have partners that are willing to, you know, be on the ground, be boots on the ground? Where do we have partners who can kind of raise up some local leaders? And what can we do next steps to work on that local policy leading us up to the state policy work? So more to come on smoke-free efforts, but I am excited about the small wins that we had this year, and I'm really, really hopeful that we're going to get some prevention and control funding. So any questions? Yeah.
Beth,
Yes.
I was just going to ask,
Yeah.
so that additional funding, where would that come in to and where would it go out?
Yeah, so we propose that the funding is given to Smoke-Free SC to be used for CDC best practices. And so I think it would be up then to up to the board and the executive director for Smoke-Free SC to split up and divide up that money. You know, our strong recommendation is let's put it into the communities to build up local coalitions. And I think in the past, that has been what has driven smoke-free communities is local coalitions where they're really successful. So, you know, that would be what we would like to encourage the board to use that money for. But that would be, you know, it's not coming to ACS CAN, it's not coming to the national partners. We want that money to go local as much as we can.
Okay. All right. And the other question I have, and maybe y'all have this, So one of our other projects that we're working on at Just Say Something is part of the opioid,
Right.
settlement money. And
Yeah.
so with that, like we have lockable prescription bottles. And so what we can say is giving out 40,000 lockable prescription bottles will keep 2.2 million pills from being pilfered and will have an economic impact of $29 million.
That's awesome.
So, but when we look at tobacco-free communities in cities, is there data out there from somewhere else that this community of this size passed a smoke-free ordinance, and as a result of that, this is been the economic impact on the good of what's happened in that community?
Yeah. Okay. So let me think about that for a second. Phil, what I know we have is not going to be community specific. It's going to be statewide, and it would be related to the healthcare savings. So, and this is actually being, I'm thinking directly of data that's on the Campaign for Tobacco-Free Kids website. And they have what it costs the state, what tobacco currently costs the state in loss of productivity, and also what it costs with Medicaid, Medicare, and then just general health care cost. That's the only thing that I could think of off the top of my head. I don't know if anybody else has any research or knows of any data.
Yeah, the hospitality industry has some data on to go against the argument that going smoke-free officially hurts a bar or a restaurant or other enterprises in a bowling alley. It hurts their revenue. So that can be cited. And then people can cite our experience in York County. We saved we reduced our acute MI presentations to our residents to emergency rooms by 20% each year. So that saves 66 heart attacks.
Wow.
And a heart attack hospitalizations probably in the $50,000 to $100,000 range. So $500,000 at least. So that's just one county, but people who are secondhand exposed and who have risk factors for stroke and heart attack, it's there, and there's a common sense savings that can be cited with that, Phil. So I think I mentioned that to you the other day, but it's there may be some other data that the hospital association or the insurers have.
Oh yeah.
Yeah.
I bet there is information that insurers have too. Yeah.
Yeah.
I don't know if that's something that you could use, Phil. It kind of points to, it's going to circle back and point to the health argument. That's where it's going to tie in, because that's where we have the data.
Yeah.
And because I know Bon Secours is getting ready to do their annual or biannual health assessment. And so we'll see. Hopefully. Yeah. But I'm just looking for more numbers to cite and things that might hit home, because these days we just don't know what's going to trigger someone to say, maybe we do need to look at this. It is an important conversation for our community to have.
Yeah.
Yeah.
And every community is so different, so you don't really know what's going to trigger them, like you mentioned, Phil. Yeah.
Yeah. Okay. Thank you.
I had two things, Beth. I had my hand up. And as far as the every year tobacco settlement money, that's still going just straight into Medicaid.
That's correct. Yes. I
Okay.
had someone ask about that yesterday and they're like, what about this millions of dollars? And I'm like, yeah, it's going straight into to Medicaid. It goes straight directly to Department of Health and Human Services.
Yeah. And the other thing, I guess, to point out, I mean, are they going to try to put any of that $1 million, say, well, it's got to go to Medicaid?
No, that $1 million that we're asking for, no, that's a good point because I'm always careful that when we are asking for new funds, that especially if the ask is being kind of generated and pushed from the American Cancer Society, that they don't try to take the money and give us the same money but rename it or reorganize it some way. And I think that we had kind of run up against that problem a few years ago. So for example, the $5 million that goes to DHEC and the $5 million that goes to MUSC, that's generated from the tobacco tax. There was some question about, well, we can take that $5 million, we can split it up and we can put it here, here, and here. We do not want that to happen. That's not what we're advocating for. So this additional $1 million that we're asking for from the Jewel settlement would go directly to tobacco prevention and control. It in the line item, it does not include, I mean, they could probably be tricky and try, but in the line item, as it is written now in the proviso, it has directly to tobacco prevention and control.
Okay.
And
All right,
hopefully
good.
would not have to go to Medicaid in any way.
Yeah. I think, maybe you could counter or fortify your argument by saying that, we know that Smoke Free South Carolina is concerned about the level of smoking and vaping among Medicaid recipients. And that, one of the targets that can be addressed, and then there'd be some savings calculations that could be brought to bear. Yeah.
And we do have the number, I think it's on TFK's website, actually, the Medicaid savings or the Medicaid impact from the toll of tobacco. So,
Yeah.
that's a good point, Dr. Keeley. And it's a little tricky right now because, we are a lot of the health organizations and ACS CAN is certainly a part of Cover SC, which Dr. Keeley and I serve on the executive board. And so it's a little tricky anytime we mention Medicaid right now. It's a little tricky. But we're still talking about it because it has to be talked about, it needs to be talked about. And we know that we could certainly fill in a pretty large gap of South Carolinians who have no access to healthcare if South Carolina would, join in the rest of the country, the majority of the country, and expand Medicaid.
Right. And the second thing I wanted to bring up, I serve on the state level League of Women Voters for South Carolina healthcare policy working group. And we talked this week actually about the the smoke-free secondhand tobacco smoke protection issue. And the League of Women Voters will sounds like we can recommend to the state leaders for the League of Women Voters that this become a priority area for the local leagues.
That would be really great.
To advocate and educate. So, Phil, that might be something that you could also look at. Contact your local leagues in the Greer area. And get them to help with the advocacy and education.
That's a great idea because they have strong coalitions all around the state.
Right.
Yeah. I know Wendy did a presentation, I think, for the one over in Anderson. So, good idea. Thank you.
That's awesome.
And then North Charleston, what's going on there, Beth? Because it was that if we got North Charleston and they have a new mayor, if we got
Yeah.
North Charleston, that would really get us close to the 50% coverage.
It would bring us really close to the 50% coverage. So North Charleston has a new mayor, Mayor Burgess. He has been involved and engaged with American Cancer Society for a few years. He participated in our Real Men Wear Pink fundraising event around breast cancer. Super nice guy. And Breathe Easy SC, which was Breathe Easy Tri-County, being led by Lashandra Morgan, they have some relationships with the mayor as well as members of council. And so we are just kind of having conversations to see, is there an appetite in North Charleston? And if so, what will that look like? How much of an education campaign do we need to try to work around and launch? And how is that going to kind of work and leading up to what I suspect is that, we'll spend some months in there trying to see about the local coalition folks, working with what they already have, seeing if there's room or need to build up, finding some local champions, and see if there is an appetite for possible ordinance in the first of the year.
Great, yeah. And again, the League of Women Voters in Charleston area, they have an active health policy work group just for their Charleston area. And Sonia Donnelly, who's been with the Palmetto Project for a number of years, she leads that group.
Okay.
And I think make sure that the Breathe Easy folks know to talk to her for help.
That would be great. They are strong. I mean, the League of Women Voters is such a powerhouse and strong group. That's good to know. Thank you. Yeah. All right. Any other questions or thoughts?
I had a couple, Beth. I did want to make a statement about the Jewel funding, if we should get it. We as an organization agree with Beth that it should be moved down to the local levels. And so that is a priority of ours. If and when we get these funds, we'll send out something to our membership to tell them that we got them, and then ask for suggestions on how the stakeholders would like it to be spent. So, and then we as a board will meet in September at a retreat to set up guidelines on it, just to give you guys an idea of what will happen if we do receive the funds. And then Beth, I have it's been a busy couple of months and I have not gotten back with you on this, but it's something Dr. Keeley had brought up in the fall, and it didn't seem to be an issue anywhere but in Dr. Keeley's area, but now has come back. I was at a Rise Above It meeting in Lexington School District 1 about a month and a half ago, and they were talking about the confiscation of vapes in schools. We have these vape disposal kits that we set up and we're distributing out to schools because it was a way to get into schools to maybe promote our vape talk and to develop partnerships out at the local level. When we started giving them out, at first we had a lot of people who wanted them, and then it kind of petered off, and it became an issue of the SROs not being able to collect vapes. They were no longer confiscating them from students. And the reason, and in the meeting that Rise Above It had, the resource officer that I was sitting next to, they had gotten a letter, do not know who it was from, Dr. Keeley probably could tell you, but it was from a lawyer that basically told them that SROs can no longer confiscate vapes because of, I would assume, the PUP laws within the preemption bill, which made it no longer criminal for you to be in possession of vapes or any kind of cigarette product, is the way it was explained to me. And so they cannot confiscate because they are worried about a lawsuit against them for taking somebody's possession that is not illegal.
Right.
Is that the way you heard it, Dr. Keeley? That's the way it was explained to me. Now that does not.
It was some legal counsel that came down from when the Rock Hill Police Department requested a legal opinion. looking particularly at the wording in that bill.
Mhm.
And that was the interpretation. I'm not sure it was the Attorney General's office or where, but that's what you said is spot on. Yeah.
Okay.
Yeah, so now that does not prohibit the school from taking it, but it's prohibiting the SRO, which is really where
Right.
the issue starts. And then also, that they have a zero tolerance policy, it shouldn't be an issue. They can get referred to services, but I know in Dr. Keeley's area, that was one of the issues. If they weren't quote unquote charged, they couldn't be referred to a program.
Right.
And so we just wanted to bring that up to you and then see if there, I know originally when we talked about this a long time ago, like I said, it wasn't a statewide issue. Now it seems to be spreading, and I'm hearing it from more than one group. So anyway, that does become an issue if we can't refer kids, we can't take their products from them,
Right. Right. So let me
Yeah.
I'm
Could it be
writing
part of the
that
cleanup?
down.
Part of the cleanup process on that bill? Yeah.
No, I don't think it was included. I'm fairly certain it was not included in 4817 for this year. But I remember we did have a conversation about this, and I do remember taking a look at the preemption language, and I think it possibly could have been the interpretation, I think, was probably extended, and it was not the intent of the bill for to not allow the resource officers to do this. But certainly we wanted to make sure that the bill had pup laws in there to protect the youth so that they're not the ones that are being directly penalized. So it may have been an unintended consequence of those pup laws. But what I want to do is take a look and see again if we need to ask for Dr. Kelly, do you know if it was an AG's opinion or you're not sure from the
I'm
resource
not sure.
officer?
I could ask the police department, or you could contact the legal support for the Rock Hill Police Department.
And I can probably do some research too on the AG's office and see if they pull down an opinion on it, and then ask if they haven't, we can make a request that they pull down an opinion to see, how that would impact resource officers at schools having the ability to confiscate the vapes. And I think it's interesting because I do think some resource officers are still doing it, whether they are legally allowed. So they might not have gotten the memo, or they may just be still doing it. But let me ask about that. And I think for me, the first place to go is I'll look at the language again, and then I'll see if the AG has an opinion on it. And if not, I think we need to request one.
Yeah.
We can do that.
Okay.
Yeah, and I can reach out to Rise Above It, to the two resource officers who were at the meeting.
Okay,
and ask
good.
them. They had their phone, but they wouldn't let me see their phone with the I'm not sure why it becomes such a, I can't let you see who told us issue. If you got it, you got it. I'll reach out to them too and see if I can figure out who they got their letter from. And you're right, it's arbitrary. We certainly have resource officers that continue to collect vapes, and I'm not going to name them here. And we certainly have counties that are still finding students and then sending them to programs. So that's why I don't think it's an attorney general's opinion, Beth.
Right. Yeah.
I don't know.
But if we need to make a counter, and if they say, oh, well, this is a letter we've received that's saying that we can't, then we can certainly counter that by saying, oh, but the attorney general says you can.
Yeah.
Right.
Definitely.
It may have just been their chief saying, you know what?
Yeah.
Let's just stay out of this and just say we can't take them anymore.
Yeah.
The way it was put to me, Phil, it was an attorney. It was an attorney who told them at the risk of a lawsuit to not do it.
I bet it was the kid's parent who is an attorney. Is like, you leave my kid alone.
Probably.
Yeah. Sharon, did you have something you wanted to say about it?
Yeah, I was just going to say how amazing that somebody on the local level was following that legislation to the point where they knew that there was that kind of change. I mean, that's remarkable to me. It's almost kind of weird, It's almost kind of planned.
Yes. Yeah. Mhm.
Yeah,
Very true.
and maybe to Phil's point, it may be a parent of a child who got their hand slapped for having one, and they were trying to find a loophole. So yeah.
Yeah.
All right. Well, any other?
Beth, can I
anything
ask a
else?
quick question?
Sure.
Do you know if the allocation of the Jewel funds would come through DHEC to Smoke Free SC, or would it go straight to Smoke Free SC?
It will likely go through an agency, and we're not
Mhm.
sure if it would go through DHEC or DHHS.
Okay.
Yeah.
That sounds cool.
Yeah.
It-
And we're
Ideally, it would go through DHHS only because DHEC splitting, and
right. That's what I was getting
we're
ready
all
to say.
hoping that we still get paid. So,
Oh gosh.
it's
Yes.
like, oh.
Yes.
So I think it would be more streamlined if it did, but I can
Yeah.
make sure internally that, things happen the way they're supposed to, as long as I know, where it is.
When we were talking to the members, they said the same thing, Sharon, that it was their preference that it would go through DHHS because of the transformation and the change. So, but I don't know, and from my standpoint, I don't care how it goes through as long as it gets to where it needs to be. That's the most important. But they were kind of suggesting to me that they would try to shoot it through DHHS. I don't know.
Sounds good.
Yeah. We're also hearing, and I'm sure that Sharon's team is hearing more on Senate Bill 915, which was the restructure bill of all the state agencies. And you all may have heard Governor McMaster a few weeks ago come out in a pretty angry press conference where he directed the General Assembly to get their butts back in there and figure it out. So the Senate Bill 915 was killed literally the last day. It was killed on the House floor by about 8 Freedom Caucus members who basically were having a showdown with other members of the party.
Oh, wow.
It was really ugly.
Mm.
Yeah, and so they counted it a win that they killed that bill, which was their opinion. I don't know. It was really ugly. I'm not sure I've ever seen Senator Tom Davis quite so upset as he has been this year. He's had a hard year leading some issues.
All right, guys, does anybody else have any questions? Kelly?
Hey, I did. I had a question. I was wondering, I mean, this is kind of not on topic for Beth, but more on just this group on who else to invite. So I had a call with like the cessation group with MUSC this week, just to kind of see their best practices, what they're doing inpatient, outpatient for referring for cessation. Would this be a group that we could open up to healthcare, to just for education purposes? I serve on some different other tobacco work groups in other states, and it's kind of a way of sharing best practices on,
Kelly, it's open to
programs.
whoever would like to join.
Okay.
Who has an
Okay.
interest in this topic. So we've
Okay.
had citizens come and join it. We've, so anybody who's interested, we'd love to have them. We've
Okay.
had MUSC come speak at it before. So we've had
Right.
speakers from there, but certainly we'd love for them to come.
Okay. Yeah. And they seemed interested. I was just talking to them kind of what we serve on, and just, again, having more, I think, knowledge across the state and different avenues. Right. So I just wanted to make sure that there wasn't a particular like standard or anything. So,
No, not at all.
okay. Perfect. Thank you.
Beth, did you have something else? I think I might have cut you off. Did you have anything
No,
else?
I was just gonna say thanks for letting me join. I don't always get to join these Friday meetings, and I'm sorry I can't join more of them, but I was glad that I could join today and share. And we're always happy to help and to, kind of bridge things at the State House if needed.
Well, we really appreciate you coming here and giving us an update. It's hard, I know, speaking from, I even worked in state government, but it's hard to keep track of all this stuff if you don't have a background in that area to know what's going on. So we really appreciate all the information you've sent.
You are
Jacob,
very
did you have a question or a comment?
Thanks all. Yeah, I didn't want to cut anyone off if they had a question first. Well, first, just want to introduce myself. I'm Jacob Delbridge. I work at Counter Tools. Just joined about a month ago, a colleague of Molly Mayfield, if you're familiar with Molly. Thank you so much for letting me join your meeting and listen in. So interesting to hear some of these updates from you, Beth. I just had one question too, actually, on the e-registry bill. I was wondering if it's similarly worded to what we've seen in other states, where it's the kind of thing where if the company has submitted a pre-market tobacco product application, that's sufficient in a way to be sort of given the quote unquote approval for sale, or to be considered allowable, even if it hasn't actually been authorized. Is it in that vein as well?
Yes.
Okay.
Yeah, it was. And so, this is not uncommon that you all know that we see these exact same bills, exact same language all across the country.
Right.
This was a tobacco bill, same language that we've seen. And I think we compared, our team did, and it was 18 states, exact same bill. So, and it would allow that kind of vague in between if you have submitted to the FDA your pre-market review. And they did a lot of talk about that at the State House, of which the senators did not fully understand how that worked. They were just focused on, look at these gummy bears and let's get them off the market. And that was all that they really were targeted in on. But exact same language, Jacob.
Yeah. The ambiguity or the confusion of it sort of can benefit, I think, a lot of the heavy hitters in the industry. Yeah.
Hey, I just want to let the group know before we close, I'm going to be doing a joint webinar with our multi-jurisdictional drug enforcement officer, Commander BJ Kennedy, on June 20th. It'll be Zoom, and it's going to be organized through Rock Hill School District's Parent Academy. And so anybody that wants to tune in or recommend folks to listen in, we're particularly going to be talking about the cannabis derivatives and the way that they are getting into the vape liquid, and kids are getting high that way, particularly the Delta 8 THC, which is able to be bought legally. And so, the whole thing about the FDA moving forward at this national level to reschedule Delta 9 or THC 9 regular, cannabis that's smoked that's illegal now, to reschedule as a Schedule 1, to reschedule it to Schedule 3. And for South Carolina, I think that removes the need for a medical marijuana bill, that healthcare providers would be then able to freely prescribe marijuana products, THC, Delta 9 THC, and there would be no need for all of this bureaucracy and gnashing of teeth on medical marijuana. So just wanted the group to know those two things. Thanks.
And Dr. Keeley will include the information on your Zoom call if you send it to us in our next newsletter.
We'll do it.
Yeah. Thanks for sharing that, Dr. Keeley. And Senator Davis, who's the champion for medical marijuana in South Carolina, has been saying that same thing. Let's just get the drug, let's just get it rescheduled. And that would solve the problem. One of the things that we're kind of looking at his medical marijuana, medical cannabis bill that he's calling it is that it would be allowed, the patients would be allowed to vape it. And so that does, of course, bring us some concern. And, not sure how much we're going to weigh in on that at this point, but of course that brings us concern.
Yep.
All right. Well, thank you, everybody. As always, this meeting was recorded and will be on our website in a couple of weeks. So just look for it there if you want to come back and refer to anything. And Beth, we'll probably have you back in a couple of months to tell us what you found out about the SROs.
I know, yes, I have it on my list. I'm gonna see what we can find from the AG's office and see if an opinion was done.
I looked, I couldn't find anything, but
Okay.
you're probably much better at it than I am. So
Okay.
anyway,
check it
thank
out.
you. Thank
Yeah.
you, everybody.
Thank you. All right.
Have a great
Bye-bye.
Memorial Day. Bye-bye.
Thanks, Barbara.
Bye.
Bye, everyone.